Everyone feels anxious sometimes, but kids who are struggling with generalized anxiety disorder, or GAD, feel anxious either most or all of the time. These worries can be about anything and everything. They don't get better, and they don't go away on their own. Today we're going to take a look at generalized anxiety disorder, sometimes called GAD, what it is, how to spot it, and how it's treated. Let's start with the symptoms of generalized anxiety disorder. The anxiety caused by GAD is intense and persistent. It doesn't change when things get better, and it doesn't seem to go away. Anxiety caused by GAD is different from regular run-of-the-mill worries. First, it's usually not realistic. Small problems turn into big stresses. For example, automatically assuming someone is angry if they don't respond to a text right away, or worrying that a perfectly healthy family member might just suddenly die. Second, people with GAD are self-conscious, constantly worrying about being perfect and living up to expectations that others are judging them, or feeling intensely afraid of doing or saying something embarrassing. It continues no matter what's actually happening in the person's life. The anxiety caused by GAD is unwanted, often uncontrollable, and it doesn't necessarily go away, even when there's a clear reason for it. For example, someone without GAD might feel anxious about an upcoming test, but when the test is over, and they might have done well, the anxiety might kind of decrease. But a person with GAD might feel the same worry about the same test, but even after they should feel relief when they get a good grade, their anxiety might stay at the same level, just shifting to worry about the next test, or a friend who might be angry with them, or worrying about a parent or loved one who's healthy and might become sick and die. The list goes on. That anxiety just sticks to the next thing you can be anxious about. People with GAD can be perfectionistic, and they can also worry a lot about living up to their own very high standards. Kids with GAD often begin avoiding doing things they might once have enjoyed or loved. They can withdraw socially, and they can also struggle in school. Other symptoms of GAD can include irritability, trouble sleeping, mainly because you're anxious, and physical signs like headaches, stomach aches, and exhaustion, again related to kind of that physical pain of anxiety. GAD is serious, help is available, and it works. Let's take a look at how GAD is diagnosed and treated. If you're concerned that you or a child or a teenager that you know might have GAD, the first step to getting help is to make an appointment with a medical or mental health professional. This doctor or clinician will ask you, and if you're a minor, your parent or guardian, some questions to help them determine if the symptoms that brought you in meet the criteria for generalized anxiety disorder. These criteria can include being unable to control your level of anxiety, having concerns about lots of different things, often real-world worries, easily becoming very upset, and having these symptoms most days for a period often of a few months. In addition, one of these symptoms must also be present. Feeling like you can't relax, being exhausted by those worries, feeling like you can't focus because of that worry, having a quick temper or being irritable, experiencing muscle tightness or physical pains, and trouble sleeping. Children are not typically diagnosed with generalized anxiety disorder until they become teenagers, and it's more common in girls than in boys, though it can definitely affect people of any gender. Let's talk about how generalized anxiety disorder is treated. Treatment for generalized anxiety disorder is usually therapy or a combination of therapy and medication. For children and teens, parents and other family members are an important part of treatment since they can help kids practice the skills they learn in therapy. The most common therapy for generalized anxiety disorder is cognitive behavioral therapy. This can also include, at times, ways of engaging in exposure therapy. When you're doing exposure therapy, a therapist can expose a child or a teen to something that triggers anxiety, beginning with something very small that might not trigger a lot of anxiety and working your way up. As a child or a teenager becomes upset or anxious, what a therapist can teach are either ways to cope with that or ways of just tolerating it and knowing that even if it doesn't necessarily go down or decrease, we can actually survive it. We repeat this process with bigger and bigger stressors to help people realize they can tolerate anxiety in any situation. Secondly, a therapist can teach a child how to recognize anxiety symptoms and how to cope more effectively when they occur. They can also discuss how the child's thinking could add to their anxiety. The therapist helps the child understand that their response is bigger than it might need to be. It can be out of proportion to the situation and teach them ways to change their thought or behavior patterns. Most CBT lasts for about 10 to 20 sessions, as long as the child or family regularly practice the new skills outside of therapy sessions. By the time you get to even the middle of CBT, most kids and teens see some significant symptom improvement. Doctors and clinicians may also suggest taking medication if symptoms are very severe. There's no one-size-fits-all approach for medication, so your doctor may suggest trying certain antidepressants that have been shown to work well for kids with GAD, or they may suggest trying certain anti-anxiety medications. Generalized anxiety disorder can be scary, but it is absolutely treatable and the treatments work. If you're concerned that you or someone you love may have GAD, reach out to a doctor or a mental health professional. To learn more, visit the Child Mind Institute Family Resource Center, which has hundreds of articles and guides to help you support children who are struggling with mental health or learning disorders. You can find the link in the description below. I'm Dr. Dave Anderson, a clinical psychologist at the Child Mind Institute. Thank you for watching. And if you found this video useful, please like and subscribe to our channel below.